All right, so tell me who you are and why you're passionate about the Youth Homeless Program.
Hi, I'm Tony. I am an outreach worker at Communtiy Behavioral Health, and I've been in this position for 3 years, and I was in a related position at another agency for about, a million years, about 12 years before that, I think. And I am passionate about this work because I've seen the real good that I can do and the position can do with youth in this situation, and I'm passionate because I get inspired by the efforts that I see these youth putting into their own lives.
Absolutely. And I'm Brandi, and I supervise the homeless outreach program. Previously did some work in a shelter, oversaw a shelter, and I think that this is a particularly vulnerable population with some very unique needs. And as Tony said, they're often incredibly resilient, hardworking young people that are in a tough situation, so it's very easy to get behind an initiative like this. And so I think that's kind of how we come at the work. It's an opportunity to have a very unique model and be able to have do some really amazing work with young people, make a powerful difference.
So why does foundation support, why is that important?
It's particularly important with the outreach program because there are no funding streams for it. It's a very unique way of approaching young people, often who are very disenfranchised and not connected with traditional supports and services, and so they don't have things like main care. And the agencies felt very strongly after the closing of a shelter in our area to maintain young people in their community instead of sending them out of the area. And we know that young people stay in situations in our area with very little supports and services and often very dangerous situations. And so we felt it was incredibly important to continue to do the work even with or without funding. And so every day we make that happen, but I think that's the piece that makes it so.
And I think that speaks to the gap that the youth are experiencing, that they're disenfranchised and disconnected from their homes, maybe from their schools, maybe from other supports, and to get them connected into systems that will help them do that takes time and effort and consistency, both from the outreach worker but also from the youth to be able to sort of meet in the middle.
And we don't have to worry about whether they have insurance or don't.
Yeah, right.
And day one when we're meeting them on the street, we're really focusing on those basic needs, and we don't have to worry about what that funding is if we have some, so it's important to do that fundraising and not have to make that be a piece of what we do.